Okay, so we're going to talk about wound packing, give kind of a start to finish overview of the process of wound packing. So remember, we're going to be using a tourniquet on an extremity for arterial bleeding. Tourniquet is the quickest, best way to stop arterial bleeding on an extremity, but if that bleeding is up too high to where you can't get a tourniquet above that wound to occlude the artery, or if it's in a junctional area of the body, which is where an extremity or your head comes into your core, such as your neck, armpit, groin, those places we're gonna have to wound pack. Remember, arteries have pressure behind them from the heart pumping, so they're gonna wanna break those clots up a lot easier than venous bleeding when you just get a regular scratch or scrape or something and you can put a little bit of pressure and it stops. So we have a lot more pressure behind these, so we have to be diligent when we wound pack, fill that entire wound with this gauze so it applies pressure there, hold pressure for several minutes, and then we put a elastic bandage of sorts like this pressure dressing from North American Rescue or an Israeli bandage. We're gonna apply that tightly to hold that pressure in place. So we'll go ahead and give you a rundown of the process of wound packing. So I've got my Quickclot. I've also got some regular gauze here. This regular gauze you can pull from the center and you can wound pack and just, it'll play out from the middle here. If you use an entire roll of gauze and you need more, just take a second one and continue on where you started from. If you start with Quickclot and you run out of Quickclot, well, the Quickclot is gonna be all the way down towards the area of the bleeding, so then we can back that up with regular gauze on top of that, because we just need something now to fill the void, but the Quickclot at the surface is really what's doing the actual clotting off of the artery and speeding up that clotting process. So you don't need to take Quickclot, pack it, take a second Quickclot, pack it, and pack 2 or 3 Quickclots in a wound. You can pack one and then back it up with regular gauze. Once it's in there, hold pressure for several minutes. Then we're gonna take a pressure dressing, we're gonna open that up, we're gonna wrap it around the wound to hold all that packing in place. One thing we wanna do before we get started is we wanna try to sweep out any blood that's in that wound. If you have a regular 4x4 gauze or something you can use and dab up some of that blood so you can see exactly where that bleeding is coming from, that's great. If you don't, then try to use your finger or something to sweep some of that blood out. The point of this is, one, to get rid of any pooled blood, because the more blood that's in that wound, the more it's gonna absorb into that gauze right away that you're packing with, and it's gonna decrease some of the ability to dry that out and speed up that clotting process. So the more blood that's in that wound, the longer it's gonna take to clot. So if we can sweep some of that out real quick, and then that will get rid of some of that moisture and we'll be able to clot off hopefully quicker. Now, another thing that we're doing when we're sweeping that blood out is we're able to see the area and the point of bleeding. So that allows us to apply immediate direct pressure to that area with a finger, and then we can start packing on top of that, but we know exactly where we need to apply that pressure rather than just blindly packing it in the wound. So let's run through this. So I've got my stuff laid out here. I've got a wound. I'm gonna try to apply immediate direct pressure to stop that bleeding as fast as I can. So look in the wound, I'm gonna sweep some of this out, find where the pressure is, apply a gloved finger directly to that area, and I'm putting hard, firm pressure on that area. Now I'm gonna take my gauze, which I'm gonna use a roll here for the demonstration purposes. I'm gonna pull the end out, and I've tied a little bit of a knot in the end. That just gives a little more substance directly on that first point of contact with that artery. So I'm gonna take this knot, I'm gonna slide it down on top of my other finger till I get close to the point, pick my right finger up, and then put pressure back down on it. Now just finger over finger, I'm gonna grab here, I'm gonna push it down in the wound, hold that pressure, and I'm just gonna start filling this entire wound with gauze. Fill it up. Once this entire wound is full, I want to pack this until it comes up over the surface of the skin. Because when we put this pressure dressing on, I want it to apply more pressure to the area of the wound than just the skin. So I want that area where I'm packing to actually come up over the skin a little bit. So when we put pressure, it's putting immediate pressure right down on that area of bleeding. So pack this in here, get it there. Okay, so it's sticking above the skin a little bit, and I'm gonna just take the rest of my gauze and I'm gonna place it directly on top. So now the biggest area right here is where my bleeding is. hold firm pressure down on that for several minutes, okay? This is giving it time to clot off. So now while we're holding this, I've got someone else getting the pressure bandage ready, or I can with my other hand, as long as I don't compromise the pressure that I'm putting here. I get this ready to go. Once we've held pressure on there for a little while, we want to make sure we hold pressure for a while before we transition to the pressure bandage if possible, because if I take pressure off this right now, it may bust that clot, and then I'm kind of behind the 8 ball now, and I've got to make up for lost time and kind of start over with my pressure here. So I'm holding pressure for several minutes. Now I'm going to apply this. So the ETD has this pad right here in the middle. I'm going to put this pad directly on top of where all that gauze is. Now my first wrap is really just going to stabilize this in place. I don't have a ton of pressure necessarily with my first wrap. Put that on, and then each subsequent wrap is going to get tighter and tighter so that I can maintain that pressure on the wound. No need to cut this, just keep wrapping. You're not going to put too much pressure on here. Okay, so I get down to the end. I've got this little Velcro strip here on this ETD, Velcro that in place, and then I've got this plastic clip that I'm going to use just to secure it to make sure it doesn't come unraveled. So hook that on one side, hook this on the other, and there we go. Secured in place. I've got my pressure dressing. I've wound packed, pressure dressing on top of there. We've got pressure. It's still applying pressure even though I'm not having to touch it now. And then we will continue to reassess and make sure that that doesn't break loose, doesn't come loose, make sure that is enough pressure and that we don't have continuous bleeding. You don't want to just throw this on and assume that the bleeding has stopped and you don't have to do anything else with it. Any of these patients that are severe enough to have to put a tourniquet on or wound pack, we need to continue to reassess and make sure that those interventions and treatments we have done for them, such as wound packing, are still adequate and they're holding and they're doing what they're supposed to. So this is an overview of wound packing. Hope you found this helpful. Stay vigilant and stay safe.